Well, I would agree that many of our all our health employees are on the front line. I think there are some who are more visible and we think of quicker. And for me, my thoughts turn to those who are often less visible, who deserve the support to protect their health, so that we can keep their services running. And one of the things that comes to mind for me is child protection services, which are under unique pressures at this point, as many of the supports for children at risk, such as teachers, coaches, youth workers, aren't present in the child's life anymore due to the social distancing. Now, I know TUSLA have introduced some changes to work practices, but many home visits still have to happen. And there is a huge difficulty where social workers are reporting to me, and I know the Irish Association of Social Workers was commenting as well, that their difficulty of accessing PPE as well. And again, this isn't necessarily the high-tech stuff that we would see in hospital settings. This can be something as simple as struggle to get gloves and hand sanitizer. So while I understand that TUSLA have engaged with the suppliers, there needs to be clear timelines and clear supply routes identified to ensure that these services can continue by keeping the staff healthy. There is also, as has been, a wide variety of community groups, of NGOs, of volunteer organisations, home care providers, carers, family carers, providing help and support to a wide variety of vulnerable people who rely on that support, rely heavily on that support. These organisations often fill a gap left by the state in health provision, and now more than ever we cannot abandon them again so that they can continue to support these vulnerable people. So I welcome the efforts, the efforts you mentioned at the beginning, Minister. My colleagues, Councillor Nasa Horrigan and Sean McCabe, have been dealing with this, and I think, while we welcome the efforts, there needs to be, again, clarity as to where the supplies of PPE are coming from. And when they would be available, and a schedule for, clear supply routes for these people. Many of the groups get little or no funding from the state, so might be invisible to the HSE. So I think it's imperative that a needs assessment is carried out in terms of those in the community, no matter where they are based, who are supporting vulnerable people, so we can get a clear picture of what's needed and how to get it out to them. Again, as I say, if these people aren't linked with the HSE or other state funders, they may be invisible, and it's very important that we capture so that family carers, home carers, and ensure that they have the PPE needed to protect their health so they can continue providing the support and the health of the person they're supporting. I think also it would be imperative that the HSE issue improved in specific guidance for people doing this kind of work. Much of the guidance is generic public advice for non-clinical settings, but the reality is that this kind of work does involve very close contact, and I think support and information will really support these people doing this kind of work. I'd also ask, has any COVID-related funding been set aside for these kind of groups? As my colleague Deputy Noonan stated, many of the Section 39 organisations are struggling under funding cuts at present. A lot of these other groups are operate on a shoestring budget, and the current difficult times is really placing them under a lot of stress. So specific COVID funding should be identified for these groups. I think it's also become quite pressing with the reports today that some home carers are going to be redeployed to nursing homes. And that makes the situation for the carers even more acute. And I would ask what plans have been put in place to backfill this need that is now being created. Getting a home care package can be a struggle in the first place. And now these people are losing it, and the lack of any replacement will be devastating for them. And many of these people, without the home care package, under the good circumstances, in the best of circumstances, without the home care package, may end up back in an acute hospital. And the last thing anybody needs now is extra pressure that is needlessly being placed in our acute hospital system. So again, what is being done to backfill any home care packages or any home care supports where either people are being forced into self-isolation, people are becoming sick, or have been redeployed into a nursing home to support that acute crisis that is in the nursing homes? Thank you, Minister.
Thank you, Deputy Costello.